Here is a question every parent and grandparent on the Fylde coast should be asking themselves right now. On this 14th of July 2026, are you actually prepared for the health risks this summer brings? Because as of yesterday, a top NHS doctor has stepped forward with urgent summer health guidance aimed directly at families across this stretch of Lancashire coastline, from Lytham St Annes right through to Cleveland and Fleetwood. This is not a routine press release. Senior NHS figures do not typically issue region-specific public health warnings unless there is a genuine and pressing reason to do so. The Blackpool Gazette reported this advice on Monday the 13th of July, just 24 hours ago, meaning the message is fresh, local, and directly relevant to tens of thousands of people waking up along the Fylde coast this morning. If you live here, holiday here, or have family here, the next few minutes could genuinely matter to your health. Stay with us. The guidance comes from a senior NHS medical figure operating within the Lancashire and South Cumbria health system, the integrated care structure that oversees NHS services for communities including those along the Fylde coast. When a doctor at this level speaks publicly about seasonal health risks, they are drawing on real-time data, local hospital admission trends, GP surgery pressure, and reports from community health teams on the ground. The Fylde coast is a particularly important focus because of the nature of its population. Blackpool, the anchor of this coastline, has one of the highest concentrations of deprivation in England, with health inequalities that mean certain residents are significantly more vulnerable to summer-related illness than the national average. The area also draws enormous numbers of visitors during July, swelling the local population and placing additional strain on NHS services at precisely the moment when heat and sun-related health conditions peak. This combination of resident vulnerability and seasonal visitor pressure is exactly why targeted public advice from a senior NHS figure is not just useful, it is necessary. So what exactly has the NHS doctor flagged? The advice, as reported on the 13th of July, centers on a cluster of interconnected summer health risks that are highly relevant to this specific moment in mid-July. First and foremost is heat exposure. The UK has experienced increasingly intense July temperatures in recent years, and even on days that feel merely warm rather than scorching, sustained sun exposure can cause heat exhaustion, particularly in children under 5, adults over 65, and anyone with an underlying health condition. The NHS recommends keeping these groups indoors or in shade between 11 in the morning and 3 in the afternoon, the window of peak UV intensity. Second is hydration. Dehydration is one of the most underestimated summer health risks in the UK, partly because British culture does not associate a mild, cloudy July day with serious fluid loss. But physical activity, even walking along the seafront, combined with even modest heat, can deplete fluid levels faster than people realize. The advice is a minimum of 6 to 8 glasses of water throughout the day, increasing that amount if you are spending time outdoors. The Fylde coast presents specific hazards that general national NHS guidance does not always capture. The Irish Sea off Blackpool, Cleveland, and Fleetwood may look inviting on a warm July day, but water temperatures remain considerably cooler than air temperatures at this time of year. Cold water shock, a physiological response triggered when the body is suddenly immersed in water below 15 degrees Celsius, can cause involuntary gasping, muscle incapacitation, and in serious cases cardiac arrest. This risk is greatest in the first 30 seconds of entering the water and has been responsible for a significant proportion of coastal drowning fatalities across the UK in recent summers. The NHS advice for Fylde coast families is clear: never swim alone, always check whether a beach is staffed by RNLI lifeguards before entering the sea, and under no circumstances allow children to wade or swim without direct adult supervision. Separately, UV index levels across the northwest of England in mid-July regularly reach 5 or 6 on the WHO scale, classified as moderate to high, which is sufficient to cause sunburn in as little as 20 to 30 minutes for fair-skinned individuals. SPF 30 sunscreen applied 30 minutes before outdoor activity, and reapplied every 2 hours, is the NHS minimum recommendation. The impact of summer health risks on this community is not theoretical, it is measurable and ongoing as of today, the 14th of July 2026. GP surgeries across the Fylde coast have faced sustained pressure throughout the summer months, with the NHS GP patient survey published in July 2025 highlighting 15 of the best-rated practices in the area, suggesting that access to primary care varies significantly depending on where you live along this coastline. That variation matters enormously when heat-related illness strikes, because the severity of conditions like heat exhaustion can escalate to heat stroke, a life-threatening emergency, within a matter of hours if not treated promptly. For families without easy GP access or those unfamiliar with NHS 111, the gap between a manageable health problem and a serious one can narrow dangerously fast. The NHS doctor's advice published yesterday is in part an attempt to fill that knowledge gap before demand on local services peaks further during the school summer holidays, which begin for most Fylde coast children within the next week or two. Prevention, in this context, is not just better than cure, it is far less costly to an already pressured local health system. One area of the NHS guidance that tends to receive less public attention, but which carries genuine risk during the Fylde coast summer season, is food safety. July is peak season for outdoor dining, barbecues, beach picnics, and fairground food, all of which involve food that is prepared or stored in warm conditions. The Food Standards Agency recommends that perishable foods should not be left unrefrigerated for more than 2 hours, a threshold that drops to 1 hour when ambient temperatures exceed 30 degrees Celsius. Undercooked poultry and cross-contaminated salad ingredients are the most common sources of Campylobacter and Salmonella infections, both of which spike nationally during July and August. Blackpool's busy visitor economy means a high volume of food prepared at speed for large numbers of people, a combination that historically elevates food hygiene risk. The NHS advice for families this week includes basic but critical steps: keeping cold foods cold in cool bags with ice packs, cooking meat thoroughly until juices run clear, and washing hands before and after handling raw food. These steps sound simple, but the data shows they are consistently overlooked, particularly at outdoor events. Looking ahead over the coming weeks, the NHS faces a familiar but intensifying challenge along the Fylde coast. The school summer holidays bring a marked increase in both local outdoor activity and tourist footfall, and both factors amplify the health risks the senior doctor has already flagged. NHS England data from previous summers shows that emergency department attendances for heat-related illness, minor injuries from outdoor activity, and gastrointestinal illness all increased sharply from mid-July onwards in coastal communities. Blackpool Victoria Hospital, as the primary acute trust serving the Fylde coast, will be operating under increased demand during this period. The proactive nature of the NHS doctor's advice, issued now, before the holiday peak rather than during it, suggests that local health leaders are attempting to shift public behavior ahead of the curve rather than simply responding to rising case numbers. If families act on this guidance this week, the collective impact on A&E demand, GP appointments, and 111 call volumes over the next 6 weeks could be meaningful. The key near-term indicator to watch will be whether local authorities amplify this NHS messaging through council social media channels and beach safety signage, which would significantly broaden the reach beyond those already engaged with NHS communications. Before we wrap up, here is the practical checklist that every family on the Fylde coast should work through today, the 14th of July 2026, based directly on the NHS doctor's guidance. 1. Check your sunscreen. Make sure you have SPF 30 or higher and that it has not passed its expiry date. Last summer's bottle in the bathroom cabinet may no longer be effective. 2. Identify the shaded routes and locations on your local stretch of the coast, and plan outdoor activity before 11 in the morning or after 3 in the afternoon. 3. If you have elderly relatives or neighbors in the Fylde coast area, check in on them today and make sure they have access to cold water and a cool indoor space. 4. If you are planning to swim in the sea this week, check the RNLI beach safety flags and only enter the water in designated bathing areas. 5. Save the NHS 111 number in your phone. It is available 24 hours a day, 7 days a week, and can provide immediate clinical advice if you or a family member shows signs of heat exhaustion, sunburn, or any other summer health concern. These are not complicated steps. But the difference between taking them and ignoring them could be the difference between a healthy summer and a preventable trip to A&E. Here is the bottom line from today's video. A senior NHS doctor issued a targeted summer health warning for Fylde coast families on the 13th of July 2026, and the reasons behind that warning are grounded in real, local risk, a coastal geography that brings cold water shock hazards, a population with significant health vulnerabilities, a visitor economy that strains NHS capacity, and the kind of July sunshine that can quietly do serious damage before you notice it. The fact that this advice is region-specific rather than generic matters. It means NHS professionals with direct knowledge of this community's health needs have identified a real and immediate concern. Respecting that warning, sharing it with your family and neighbors, and acting on the practical steps outlined is the simplest and most powerful thing you can do to protect your household this summer. If you found this video useful, share it with someone on the Fylde coast who needs to hear it. And if there is a specific aspect of summer health in the Blackpool and Fylde area you would like us to cover in more depth, tell us in the comments below. Stay safe, stay cool, and look out for one another. That is the message from your local NHS this 14th of July.